Thank you for participating in the Office of Health Promotion module for Residence Life student staff. This is meant to only be a short introduction to the department, its functions, and resources. If you are interested in learning more about a specific program under the umbrella of OHP, please contact us. Contact numbers and emails will be available to you at the end of the module. This module also includes a short quiz, and you're encouraged to test your knowledge of the department and its initiatives. As a special note, there's content included within this module that briefly covers sexual and relationship violence advocacy and prevention. We are aware that this could be a trigger for some and ask that you make self-care a priority in any way you see fit. If you would like to speak with a Respect advocate, please call 404-727-1514. Thank you again. At the Office of Health Promotion, we are devoted to engaging students in the work of creating a healthier campus, building individual capacity for health, and advocating for students in times of crisis. We do this in a variety of ways, from the individual level all the way to changing campus culture. Health is created by caring for oneself and others, and by being able to make decisions and have control over one's life circumstances, and by ensuring that the society one lives in creates conditions that allow for the attainment of health by all its members. Everything we do at the Office of Health Promotion to promote your wellness is related to our mission. Since health, learning, social justice are inextricably linked, health transcends individual factors and includes cultural, institutional, socioeconomic, and political influences. Therefore, as a part of Emory's division of Campus Life's community portfolio, our mission is to facilitate student flourishing and build capacity for a healthy Emory. Flourish, Emory.
All right, Flourish Emory aims to redefine the conventional meaning of student success by fully embracing wellness on a continuum from languishing, check this picture out, this is a languishing picture, to flourishing, thereby influencing Emory culture. Through a continual process that engages multiple community partners, Flourish Emory strives to evolve Emory's campus culture to perpetually create conditions that make every student more optimistic, happy, and read that, satisfied. So two initiatives that focus on student success beyond academic achievement are the Happiness Bootcamp and the Good Life Lecture Series. Now, Flourish Emory saw a much needed focus on helping students flourish at Emory University's academically rigorous environment. This sparked the creation of the Happiness Bootcamp, a 6-week program for students so that they can become more resilient towards the various stressors they may face at Emory University. The Good Life Lecture Series seeks to facilitate a meaningful exchange of ideas on how to lead the good life, and it attracts speakers whose experience and knowledge provide distinctive and challenging understandings on how to lead such a life. An audience comprised primarily of students can benefit from their wisdom as they move forward constructing their own personal version of their stories. Past presenters include topics on money and happiness, positive psychology and flourishing, resilience and happiness, and One Woman's Roadmap to the Good Life. All right, as an office dedicated to assessment, we have different health statistics available to Emory students, faculty, and staff. The ACHA-NCHA survey is the biggest survey on health behaviors at Emory University. The Emory ACHA-NCHA is a web-based survey that assesses undergraduate, graduate, and professional students' perceptions and behaviors related to a comprehensive spectrum of health issues. The Office of Health Promotion administers this survey once every 3 years, with the most recent being in October 2014.
Respect program. The Respect program is Emory's central hub for sexual and relationship violence prevention efforts and programs to create a more survivor-supportive campus community. We use a public health and student engagement approach, utilizing population-level strategies to promote a community free from sexual and relationship violence, while also offering support and resources to individuals who have experienced violence. We educate, train, lecture, and advocate for healthier relationship norms, increased knowledge around consent, support, and what violence looks like, respectful sexuality and sexual communication, and effective institutional policies and procedures relating to these issues. The program consists of 2 professional staff members dedicated to prevention and direct advocacy, 2 graduate assistants, and several student interns throughout each semester. Respect also advises student organizations and initiatives with diverse membership, including Sexual Assault Peer Advocates, or SAPA, Alliance for Sexual Assault Prevention, or ASAP, Grads Against Violence, and the Greek Initiative. Approximately 1 in 4 women and 1 in 33 men will experience some form of sexual violence during their time at college. Rates of violence are even greater within transgender and gender non-conforming communities. Prevention must start earlier, even before students ever arrive on campus. It starts with us understanding Emory's values and how we as a community are all responsible for supporting each other and condemning violence in all its forms. Education on this issue is the critical first step, which is why the Respect program leads and facilitates initiatives such as Haven, Creating Emory, The Talk, and Emory Apps, Active Bystander Skills Trainings, all to ensure that the campus community is informed.
Alcohol, tobacco, and other drugs. Alcohol, tobacco, and other drug services is the arm of the Office of Health Promotion that works with the Emory community to develop individual, interpersonal, and community-based strategies that decrease the incidence of high-risk alcohol and other substance misuse, resulting in personal injury, community disruption, and academic, personal, and legal consequences. ATOD services is staffed by a licensed clinician responsible for screening, brief intervention, and referral services for students, and a prevention strategist charged with co-creating and communicating theory-based, data-informed policy to stakeholders within campus life, faculty, and university administration. They train and consult with these stakeholders in order to ensure understanding of and compliance with these policies. ATOD is also home to the Emory Restart Collegiate Recovery Program for students seeking positive affirmation and support for sober living. Restart participants connect through meetings, social events, and service that highlight that recovery works at Emory. At the hub of Restart is a sober house, which will provide living space for 3 students who are accepted and are interested in living with students looking to strengthen their recovery. It is important to note that the Division of Campus Life recognizes the potential for disciplinary action by the Office of Student Conduct may act as a barrier to students seeking medical assistance for themselves or other students in alcohol or drug-related emergencies. Therefore, the Division of Campus Life maintains a medical amnesty protocol. Undergraduate students needing medical assistance during an alcohol or other drug-related emergency will not face formal conduct action by the Office of Student Conduct for the mere possession or use of alcohol or drugs. Medical amnesty applies only to alcohol or other drug-related medical emergencies, but does not apply to other prohibited conduct such as assault, property damage, or distribution of illicit substances. For more detailed info on the policy, please visit the Medical Amnesty page located on the Alcohol, Tobacco, and Other Drugs page on the Office of Health Promotion website.
Healthy sexuality. At the Office of Health Promotion, we want you to have the skills to shag well excel. Safer sex is healthier sex, and we believe that sexual health cannot be achieved and maintained without respect for and protection of certain human rights. These rights protect one's freedom to fulfill and express their sexuality with due regard for the rights of others and within a framework of protection against discrimination. OHP offers safer sex materials by request, as well as support for student organizations and class projects, participate in condom distribution, and hold mini courses and workshops. Many of these services are provided by SHAG, the Sexual Health Advocacy Group, the department's student group dedicated to promoting positive sexuality through education, discussion, and providing resources. OHP also offers the comprehensive mini course, Do You Want to Be a Sexpert?, which is open to all Emory students. This mini course is nothing like what you might have experienced in your high school sex education class. In these sex-positive sessions, you will learn about healthy relationships, preventing STIs and pregnancy, ways to improve the sexual experience, and much more. Sexpert is a fun, safe space for students of all gender and sexual orientations to talk about sex together. For more information, visit www.studenthealth.emory.edu/HP/healthy sexuality and click on the Safer Sex at Emory tab.
Sleep well. Sleep Well is a self-guided program for Emory students offered by the Office of Health Promotion. The aim of Sleep Well is to help you improve the quality of your sleep. OHP recognizes that people who don't get enough good quality sleep every night can experience a range of negative outcomes such as depression, stress, mood swings, lack of concentration, lower grades, and poor physical performance. Through the use of videos and resources, we explain how to create and maintain a consistent sleep schedule and develop habits and behaviors that will help you sleep better.
Student Health 101. Student Health 101 is an online magazine with information for college students. The Emory edition features information related to our campus, with contributions from the Office of Health Promotion and others. Read the latest edition of Student Health 101 by visiting our website and following the prompts as you see them in this module. So that's us in a nutshell. 7 full-time staff members, a host of student staff, and a passion to build community by creating health. We're pretty awesome on purpose. If you have any questions about how we do what we do, suggestions of how to incorporate this into your programming, or you just want to get involved with any of the initiatives you saw today, don't hesitate to send us an email. Oh, and remember that time I said something about a quiz? Well, it's that time. The next few slides will test your knowledge on what you've learned today. Feel free to take it as many times as you like. The Office of Health Promotion thanks you for your time.